This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Amber Giroux with me and Donna Stratton. You're with the Rideau Community Health Services and you're with the Brockville Outreach Team. Welcome to FYI.
It's actually Amber Gilmore.
Amber Gilmore?
Yes.
I'm sorry. Okay, I'm Amber Gilmore. Okay. And you're both with the Rideau Community Health Services. And Amber, you and I have met before. You've actually given me a COVID shot.
You betcha.
Yes, excellent, excellent. So we're going to talk a little bit about a lot of what you guys do. It's amazing what you do. So as an outreach team, what is that? What do you do?
Yeah. Do you want to start?
Sure, I'll start.
Okay.
So I'm a community health worker and Amber's a community registered nurse. So we go out to different agencies and different places where people who may not be reached by regular services, we try to find them. So like we have different clinics like at the Community Cooperative Care Center, the shelter in town. We have Interval House at 25 Front Street, Change Health, the EEC, and so on. So that's what we do. We like to go out to where the people are and make ourselves available at the many different places that people go to.
I understand that Rideau Community Health Services does so much. So that's what you're going out and telling people about you so they can come and get your services?
Well, to some degree. So as like a community health worker, Donna does a lot of system navigation. So she supports referrals for mental health counseling. Any type of referral that someone may need. And then as a community nurse, I'm often seeing infections. So whether it's wound care related, maybe it's lung health related, maybe they've got some pneumonia brewing, those types of things. Maybe people are struggling with not being able to sleep, or maybe they're struggling with some mental health and they don't know where to turn to or how to access prescriptions. These are things that in the moment we are offering. We try and fill the gaps really. So like we've just recently rolled out like a women's sexual health clinic, really focusing on like preventative care. So in the moment when people are where we're running our clinics, they can access whatever they need in that moment. So honestly, it ranges from one end of the spectrum to the other end of the spectrum.
Okay, and we try to meet some people have been stigmatized or judged when they go into different institutions. So we try to be that bridge by going out and meeting them and hopefully bringing some people back as well.
So as part of the Rideau Community Health Services, your outreach workers, you go out and make sure people get the support they need. It may not be back at the Rideau Community Health Services.
Right.
You just make sure that they get it.
You got it.
Another really awesome thing actually is we have so many amazing community partners. So if we can't provide that service, we're definitely able to find that service amongst the folks that we're serving with.
Okay, so now how did the two of you get working together?
Go ahead, Donna, that's on you.
Okay, well, but I've been actually here, it's my year anniversary this week for Rideau Community Health Services. I'm only here because of this woman, actually, and she's going to roll her eyes. I know one minute I said that, I could feel the eyes rolling, but she's been campaigning for a community health worker for Brockville for a long time. Our agency has community health workers at our other locations as a fixed position, but Amber recognized the need that Brockville needed someone who was able to help navigate the system. So she advocated for that, and that's why I'm here. And I'm very grateful to be here.
Oh, there you go. And that's how you two got together.
That's right.
Okay, so you've been here for a year, and you've been here for, how long have you been with?
Yeah, so I think I've been with Rideau for 7 years. I was in a different position in Smith Falls previously, and I've been in Brockville for probably about just over 2 years now.
Okay, and then you reach out too as well, because I know you from the Kempville area.
Right. So I also do congregate living, which I think we mentioned. Mm-hmm. So that's going out and supporting folks who are in group homes or living independently and just need that extra support. So go there. I do a lot of ear flushing, injections, a lot of health teaching for the staff. And then also Donna and I do offer some amazing groups with developmental services of Leeds and Grenville. We have a lot of fun. Yeah. And we also support the LLG AMH group homes as well. So yeah, we between like health services that we're also offering the social component of groups, and it's a huge. We love it.
We love it. We absolutely I think I know I don't want to speak for you, but I absolutely love working with this woman and love my role and what I do here. And I look forward to it every day. And I can't say that for other jobs I've had.
Yeah. Yeah.
And isn't that nice to say? That's so nice
It really
to
is.
say
So nice.
and be able to do that. Come to work every day with a smile on your face.
Yeah, for sure.
Definitely.
We're quite lucky.
Very lucky.
Yeah.
All right, so I'm wearing my social work hat here too. Do you have like a caseload, or is it like you go out and find people and make sure that somebody else has a caseload? They're on a caseload.
That's a good question.
I mean, I think it's a little mix of both, actually. We just pulled our roster this week because we weren't sure. I mean, people are transient, so they come and they go. So yeah, we pulled our caseload from January till last week, and we had about 175-ish folks
Wow.
on our radar.
For the past 5 months.
Yeah.
Wow.
Yeah. So
Snapshot.
whether we see people every week or not, like it's not consistent that we have 175 folks, but we keep our eye open for the folks who we come in contact with.
Yeah. And then for the ones that, like Amber said, we have so many great community partners. So when we know someone's a better fit or can get access to services faster, immediately we're gonna be doing that referral and that warm handoff, warm
Excellent.
introduction.
Can you give us an example of a good news story?
Good story.
Put you on the spot.
Right on the spot. Yeah. Actually, why don't we talk about our individual who didn't have primary care, was very standoffish when we first
Yes.
met them. So we met this individual and they had a skateboarding accident, and we had never met them obviously previously, and it was a community partner who was like, you need to see this individual. They have a cut on their hand, but they're very abrasive to meet you. So it really was just like a warm introduction, offered some wound care, and that was it. We parted ways. And ever since then, like it's someone who we're quite involved with. They're struggling with like a journey of cancer, and so we've been able to connect them with primary care, with specialists, OHIP.
Yep.
Probably more than just OHIP. Anyways, It's been phenomenal actually seeing this individual be able to access care. And just even like the folks who we have like introduced this individual to are treating this person with dignity and respect and making them feel as if they are important, because they are.
And they deserve the dignity and respect.
So without getting into too many details, because it's a small community, I think that's
a big success story.
Absolutely.
Yeah.
Absolutely.
Yeah.
And you know, we work in this field, and I'm learning all the time too what resources are out there available to people. But when people are in the moment and they go through something, and you know, they could be living in Smith Falls their whole life, they could be in Brockville their whole life, and they didn't know you guys were available. So outreach is so important, because you go look for them and you help them.
Absolutely.
Yeah.
And another thing we like to do is, they just said, people don't know about the resources available in the area. So we held a community forum in the fall where we invited over 20 different agencies to set up in Loaves and Fishes at 25 Front as a way for the people to learn about what's available in the area, and an opportunity for the community to come in and get to know other people that they might not take the time to get to know. And we're actually doing another one in the summer coming up as well. This is another opportunity for sharing.
It's July 25th.
It is July 25th, and we're partnering with the Brockville Police Services for movies in the park. And we're going to have a community forum for the 4 hours before.
Yes.
Yeah, I think we have about 13 or 15 agencies lined up right now already. Yeah.
Yeah, so it's a great opportunity for just the general public to come down to the Brockville train tunnel from 4 till 8. So it will start off with all our agencies being there, sharing information, engaging with just the general public, and then we'll end with movies in the park, which is being hosted by the Brockville Police.
And free barbecue. We can't forget that.
Do you find that a lot of people, when you do these things, people will go, wow, you know, I didn't know about you guys?
Yeah. It's a great opportunity for the public, but it's also a great opportunity for us as community providers to learn like what our partners are doing. And it's amazing what we actually learn. We think we know what our partners offer, but we always learn something.
Absolutely.
And we always
and
have
vice
to
versa.
continue learning. We always have to continue learning. How bored would we be if we thought we knew it all, you know?
Absolutely. Yes.
Oh, well. Now, how do people get a hold of you if they need you?
Yeah, again, good question. It's pretty informal. So it's like for congregate care, the people who are working in the group homes contact us. And then for the folks who are precariously housed or living a bit more in a little bit of a more vulnerable situation, again, like they know how to get a hold of us. They have our number memorized, actually.
They do.
So whenever they have access to a phone, they'll give us a call, or they'll have a worker reach out to us. We're also like, they know where we are where we are at what time.
Yeah, they know our clinic
So
times.
like on Mondays, they know we're at Change Health. On Wednesdays, they know that we're at LLG. And then Monday evenings, they know they can get us at the Cooperative Care Center. So they know where to find us. Yeah.
I like that you have evening hours too, because not everything happens Monday to Friday.
Right.
Yeah,
That's
9
right,
to 5
exactly.
in social services. No.
No.
You got it.
No.
Yeah, that came about the evening hours because the shelter in Brockville, the Cooperative Care Center, is only open in the evenings. Like they're overnight, right? So they open at 4:00. So this happened before Donna came on, but I was like, oh my goodness, when are we ever going to service the folks who access this service? Like I work Monday to Friday, 8:30 to 4:30, and obviously without management, without winking an eye, it was approved.
Yeah.
We service the people where they're at. We meet them where they are.
And we've had, like, I just want to jump in on that. We've had such great support from our CHS and our supervisors. It's been incredible. They've given us the freedom to allow this program to grow how it should be growing.
And
we're very grateful.
You said it perfectly too. We have to support people where they're at.
Yeah.
Exactly. Otherwise, we're not going to see success, right?
That's right. That's right. And
Yeah.
that's what makes us happy, and that's what makes us want to come to work every day, right?
That's it. You got it.
Well, I thank
Yeah.
you, ladies, because I have a feeling yesterday when I contacted, it was Christian, but I guess they're on holidays. But you guys got put on the spot pretty quick to do this for me today. So thank you very much for doing this.
No worries.
We appreciate your time.
This
Yeah.
was awesome just
Yeah.
to spread and share what we do. And it's something we're passionate about. So we could talk forever about
Yeah,
what we
you can
do.
invite us back and we'll love to
Oh,
come back.
well, you guys should be very proud of yourselves because you do wonderful things for people, and that's what the world needs more of. So,
Aw,
Thank you
well, thanks,
so much.
Kathy.
Sounds like you do the same too.
well, you guys are amazing too. So, thank you very much for joining us today. Rideau Community Health Services. I've got the Brockville Outreach Team, Amber. Sorry, I was going to say Amber Gilmore. Oh, I'm all over the place.
You got
Gilmore's
it.
right.
Amber
Gilmore's right.
Gilmore and Donna Stratton.
You got it.
I got that right. There we
Perfect.
go. Yeah. Thanks for
Awesome.
joining
Well, thanks
us.
so much for having us.
All right, and we will talk again real soon. We got
Right
more.
on.
We got
Thank
more to
you.
talk about, obviously.
Yes, we do. I love that. Take care, Kathy.